Hello, I'm Dr. Robert Lelouch, a board-certified OB/GYN physician with over 30 years of clinical experience. And this video is about care for miscarriage. So unfortunately, if you've been referred to this video, you're experiencing a miscarriage. I'm very sorry you're going through this. Very difficult time, and your provider, your physician will hopefully guide you through this process and help explain some details of what he or she thinks is the reason for your miscarriage. I'm going to give you just some general information that we use to guide you in the case of expectant management. Expectant management is when we just follow your hormone levels and let your body take care of the process of passing the pregnancy and moving on. I'll have another video on management with a D&C, which is a procedure to empty out your uterus. So a little bit of preliminary information. The most common cause for miscarriage is a missing X chromosome, and this is the cause in approximately 70% of the cases. Being a human being, the risk of miscarriage on the average is about 1 in 12. That risk does increase with age. An easy number to remember is 1 in 4 at 44. So the risk is pretty level, but about 35 years old, that's when the risk of miscarriage starts increasing, going up to the 1 in 4 at 44. There are other things that are associated with miscarriage. You can see some of my other videos and talk to your provider. That's not the purpose of this video. The purpose of this video is to walk you through what's the process for expectant management. Well, what we normally do is, if you have an early miscarriage, like if you're 8 weeks or below, or even 12 weeks or below, depending on your circumstance, your doctor may suggest that letting your body pass the pregnancy is better than doing a D&C, or they may have given you the option. There are pluses and minuses. It does end quicker if you have a D&C, but there is a higher expense. You do need anesthesia, and there is a small risk of the procedure itself of a D&C. We generally follow hormone levels. It's called the quantitative beta-HCG, which is the hormone level that we use in a pregnancy test to tell you you're pregnant. We watch that go down to make sure that you don't have a rare but significant problem where, even though the pregnancy is not working out, the pregnancy tissue, the placental tissue, keeps growing and can potentially cause a problem. That's called gestational trophoblastic neoplasia, or you might have heard of a molar pregnancy. It doesn't happen too often, but if it does, it can be a risk to you, and it can progress to something that is rare but very concerning. So the safer approach is to watch your hormone levels. They should start drifting down. You might be 5,000, 20,000, 50,000, depending on where you are, but the hormone levels will go down. In general, in my practice, I watch it go down every 2 weeks and see a patient back in 4 to 6 weeks. Again, that depends on your exact circumstances, but often that's the case. So you'll get the hormone levels, watch it go down. Once it go down, we generally do a follow-up visit, do an exam, and kind of go over the whole assessment with you, what we think might have happened, how can we reduce the chances of this happening again, and also consider birth control if that's your desire to avoid pregnancy. For years, and you might find this somewhere on the internet, we recommended 3 to 6 months of pause of avoiding pregnancy before trying again. The latest information suggests that there's no value in that, other than giving you a time to grieve. It's certainly an upsetting time, a difficult time. Your periods may be irregular during that time, and as long as you're not bleeding dangerously, we don't consider it abnormal unless it continues past 6 months. Again, that's after your hormone level goes down to the non-pregnant level, or nearly so. You can, once you are confirmed not pregnant, again, check with your provider. This is for information purposes. I don't know your specific case, but once it is confirmed that there's no way that you're going to get a pregnancy and that you are having a miscarriage, then we often prescribe Advil, ibuprofen, non-steroidal anti-inflammatories, which help with the cramping, but are not recommended when you are pregnant. So you need to clarify that for yourself. Okay? We want you to get support. It's very difficult to go through emotionally. Get some help. There are support systems. It is often for couples to deal with the stress differently, and can sometimes bring some relationship friction. So that adds insult to injury, but unfortunately it does happen. We encourage you to talk to your provider for your specific case. If you find that the hormones or the discomfort or the sadness from the experience is overwhelming, please be sure and seek out help. The hormones of pregnancy can make it worse, and there are all kinds of support systems in place to help you. Please contact your provider. To summarize, there will be a separate video for having a surgical procedure to handle, but if your doctor has suggested or recommended, or if you have elected to have expectant management, then you follow the hormone levels go down, and often you can get through it in a few weeks to around a month, depending on what your hormone level was. And please be sure to have a follow-up to get your questions answered, because when you get the news, it's often a time where you just are too emotional to hear some of that information, and it's good to have a follow-up to get your questions answered. I've also provided some links below so that you can get further information should you desire. I hope you found this information of use. Please leave your comments. Thank you.